All right, hello everyone. Thank you for coming to a PAs of Color virtual panel by Pre-PA Transfer Association at UCLA. My name is Sarah and I am the president of this student organization at UCLA. Min, do you want to go ahead and introduce yourself?
Yes. Hi everyone, my name is Min. I'm the Director of Events. Thank you so much for joining our PAs of Color virtual panel. We have some great questions lined up that we've created and curated from RSVP forums that we'll get a chance to ask our panelists. So to our guest speakers, Karen, Tony, and Ron, thank you so much for taking the time out of your Friday to speak to us. You've been such great mentors to pre-PAs, and we're really looking forward to learning from you today. So if panelists can please introduce themselves and tell us a little about what sparked your interest in medicine and what solidified your desire to pursue the PA profession.
Did you mention my name? Oh, go ahead, Tony. I thought you mentioned my name. I was like, wait a minute.
Yeah, I did, Karen.
So
Hi.
I am Tony. I'm one of the physician assistants here at Children's Hospital Orange County, as well as I do emergency medicine across the street at St. Joseph Hospital. So what sparked my interest in medicine was the lack of medicine or the lack of close connections with medicine in my community as when I was growing up. So I noticed that it was a really big disconnect of patient and provider. So I was like, you know, when I become a provider, I want to be that one provider that everybody's going to remember. And I think I've been pretty successful.
You can
I'll go next.
Order. Yeah.
Okay. Hi, everybody. My name is Karen Calcano. I am coming at you from Fort Lauderdale. Thank you so very much for having me. It's an absolute honor, especially since I just got out of the OR and I look like crap, but you know, it's the message that matters, right? Well, I'm originally from Dominican Republic, and what sparked interest in medicine for me was a kind of a strange path because it came through the veterinary medicine route. So I was on the path to become a veterinarian. I was that little girl that loved animals. And I was on that path until I was 21 years old when I graduated college and had been working in veterinary medicine for a long time. And then I realized that for me as a first generation immigrant, it wasn't feasible for me to go to vet school because the amount of debt and the amount of money that I would have made coming out would have put me in a position where I was not going to be able to pay my loans. And I witnessed this with my veterinary friends that were veterinarian, where they were like financially struggling because coming out of vet school at the time, they were making like $40,000 or so, which they get into like as much debt as we do. So my dream kind of died, and then I discovered the PA profession, which was at the time I was working in emergency veterinary medicine, was parallel to what kind of I was doing in veterinary medicine. I was already, you know, treating patients, diagnosing them, you know, in a trauma setting, you're having to make quick decisions and prepare the patients for the vet to see. So I kind of felt like I was a PA in veterinary medicine of sorts. And then I discovered the PA profession, and I thought that I had imagined it and thought it up. It was perfect. I didn't even know it existed. I had never met a PA in my life. And then a month later, I was applying to PA school. So it kind of happened very serendipitously for me. And best decision I ever made.
All right. Hi, guys. My name is Nan. I'm also coming from Florida, specifically currently in Orlando. So with my background and kind of why or how I fell into medicine was just seeing what my parents experienced. You know, they immigrated to the US from Vietnam, and, you know, not knowing English very well, I saw their language barriers and, you know, and how that affected their care. And so, as what I'm sure we'll discuss in greater details, is just to, you know, why I joined the PA profession and why I joined medicine was just to include or to broaden that diversity and wanting patients to recognize and see providers that speak the same language they do. So thank you guys for having me today.
Thank you so much, everyone. Let's get started with our first question. How did your programs prepare you and your cohort in providing culturally relevant and sensitive care? And what were, if any, places you found community on and off of your campus?
And we can go
Um,
in any order with this one.
Yeah, I guess maybe if we go in alphabetical order, that puts me first, and then and then Tony. Is that okay with you guys? So we're not, having this like, oh, who's gonna go? Okay. So I went to Nova Southeastern University in Fort Lauderdale, Florida, and how they prepared me to deal with diversity and healthcare was one PowerPoint lecture. And also, of course, like, the clinical rotations you get exposed, but school mediated diversity training, I believe it was one lecture. And then there was one day where it was like International Day or something, and everybody got to present, certain countries and stuff like that. But that was kind of as far, but I went to PA school back from 2005 to I graduated in 2007. So that was really the only thing as far as patient care goes. As far as like classmates and cohort, my class was probably as diverse as it ever was at the time, but still very much mostly Caucasian. I believe we were exactly like the statistics. It was mostly Caucasian women, and we probably had about 5 or 6 people of color in a class out of 70. So our training for clinically was very succinct. So obviously us as classmates, we kind of like drew to each other because we were experiencing something completely different than everybody else. And we kind of helped each other out and helped other people to kind of like navigate certain things and certain cultures. Like there were a couple of Hispanic people, so we all kind of like helped translate and kind of bridge the gap. That's about it. And that's my personal experience. Nan?
So I'll say, as the newest grad from one of the panelists, not much has changed even a decade later. With everything that's been going on in the news this past year, I feel like programs are finally hearing us out and there are more discussions about diversity. But honestly, I did my training down in Miami at FIU, and that is a pretty culturally diverse, area. But as far as training or lectures, like what Karen said, maybe one lecture at most. I would say most of my understanding on health disparities really came from my public health background, and that was with my master's in public health. But as far as PA school and even generalizing medical school as a whole, I think we need to do better. And I think you guys are right on track by having this discussion today.
And I agree with all the other two panelists, Karen and I went to University of Washington up in Seattle, or I was in satellite campus in Spokane. So I was only African American male. And when it came to a diversity talk, it was, one lecture, and then we kind of broke up in groups, and we researched other ethnicities, and then came together and spoke about everybody else's ethnicity. So, which was not great because I wanted to be with African Americans so I could talk about my experience and the experience of my people. But, and then within the population of taking care of people within Washington state itself, it was not, some areas are diverse than others. So you don't really get to experience everything while you're in school. It's mostly once you get out of school, or if you go through public health, and I did public health as well. And so with my public health, I was able to experience all the disparities within San Bernardino County, which is the biggest county within the United States, and it's very diverse. So this discussion, just like Nang was saying, is that it needs to happen because a lot of people are very qualified, but they're getting lost in the whole pushing you through different testing and stuff like that. So this is a very important discussion to see how do we get people that look like everybody in the United States to become healthcare providers. So people that want to seek out medical attention have somebody that they can relate to on just ethnicity, because my experience as an African American male is not going to be the same as another African American within that's trying to seek care, but we can kind of relate because we've seen some of the things that we've seen as we've been growing up. So that's where my take is. And once again, thank you for having me.
All right, thank you for your great responses. Now for our next question. Admissions is said to be the gatekeeper to the PA profession. If you had the opportunity to address PA programs admissions committee on the ways in which they can mitigate and root out biases in their admission process, what would you suggest to them? And we can start with Karen again.
Hi. Well, there's a few things, like how much time do you have? But I think that obviously because it applied to me, I think I'll just start with the cost of it. The cost is a huge barrier to entry for so many people. And I don't want to just make the assumption that every person of color is also of lower socioeconomic status, because obviously that doesn't always happen. However, for people that are like myself and like Nan, that are first generation people from other countries, you really are living a different kind of life than the people that have been here perhaps a little bit longer, that we're having to deal with a different set of things. For instance, my parents didn't speak English. I'm navigating college applications by myself. I'm having to help my mother at home. So I'm having to work as a teenager to help the household. I'm having to babysit. So I feel like the price is a huge kind of deterrent for people that just aren't able to do it. And in that same vein, I really believe that the shadowing and the healthcare hours and all that stuff is unfair. Who wouldn't love to have a healthcare job that they could also get paid to take care of their families? God forbid you have somebody that's a mother that's applying. We usually, like, if they're anything like me, you have no role models. I didn't know any PAs. I just happened to fall upon, because one of the veterinarians that I worked for, his niece was in PA school, Caucasian, his niece was in PA school, and he was like, why don't you become a PA? I'm like, listen, no offense, but I think I'm past taking blood pressures in doctor's office. I didn't even know what it was. I thought he was talking about an MA. And I feel like the price is a huge one. The testing is a huge one, again, because it just adds to the price of admissions. And I feel like there should be a different way of evaluating experience for the people that don't necessarily are able to do the healthcare experience. I don't know what the answer is, to be honest, because I do think that it cannot take out the merit out of being able to qualify to be able to handle the rigorous curriculum and the career in healthcare. But I do feel that more work needs to be done in this area, and I don't have the answers, but I think that at least opening the discussion and starting there with the cost, and and also secondary to that would be more visibility. Like I always said, ever since I graduated, like I don't, what's a PA? Like who knows what's a PA? Like I went to, when I was 15 years old when I came to this country, and I finished high school in New Jersey. There wasn't anybody coming in talking to us about PA. There were no healthcare people coming in and telling us there's so many different careers besides a doctor, lawyer, the business person thing. So I feel like we definitely need more visibility earlier in our careers. Get into the inner city school, get into the places where people of color hang out more, educate the children, start them early. I don't feel like the PA profession as a whole has any effort whatsoever in getting into those spaces, because the truth is that the change doesn't really apply to the people that are running the profession as a whole. It doesn't personally apply to them. So it's going to take people of color like us to get in there, because we are invested in these changes to make the changes. I mean, I can go on and on, but let's start there. None.
Well said, Karen. I mean, you pretty much took the words out of my mouth. I think certainly financial barriers, and especially now that they've added, since I've graduated, which wasn't that long ago, they've added the Casper exam, the PA CAT, and, who does that benefit? It doesn't really even benefit the programs, institutions, but these money-making tests, facilities. So I agree. I don't have the answers. I've been listening in over the months, trying to figure out what we can how we can address and have more, students to apply. But I think until we can figure out a solution on these barriers with testing and financial costs, I'm not sure there is one. And then kind of on a segue to what Karen said, as far as visibility, mentoring, going to just high schools in general. Like Karen said, I'm the first one in my family to graduate from high school, college, graduate school, all of the above, to even pursue medicine. I did not realize how important grades were. That's something that I think a lot of us fall into, being the first one in our families to kind of navigate that pathway. And so, not having the best grades, not because we're not capable, but because we just kind of lack the understanding of how important these grades will translate to admissions down the line, that too creates a barrier for, amazing, passionate providers that are so ready to join. So again, I think we're going to have to leave this with a big question mark on more research and hopefully just continuing the discussion so that we can all have a seat at the table.
And I don't really have much to add to that because you took all the words out of my mouth. So, the visibility thing that we're talking about is something that, I've been working on it personally, trying to be more visible, on social media, because people all across the world, they only know doctor and nurses. They have no idea what a PA is. And so I get people calling me doctor all the time, but everywhere else I put physician assistant, all of my stuff. But it's kind of hard to go back and eat every comment and say, no, I'm not doctor, just call me Tony. But is trying to be visible to the next little kid that think that they should become a doctor. Being a doctor is great. I work with a bunch of different doctors, and a lot of them should not be doctors. And some of them, they are very good human beings. But if you work with a PA, all of them are good human beings. We love what we do. We're not burnt out before we get to year 4 of school. We're out of school in 2 years and we're ready to go. And we're ready to go. As long as we got a good job, as long as we got a good attending, we're good. And so the visibility of us reaching back and trying to show people what a PA is and what they do is something that's very pertinent. Right now, I'm working with a few folks to try to make something in paper to bring to elementary schools, which I normally go and talk to kids all the time. And I usually do these Zoom conferences with kindergartners. It's crazy, right? But these are the things that are needed to show who we are. And then from there, we can start picking the diversity picture of this, because until we can show other nationalities or races or ethnicities that there is more to medicine just being a doctor and a nurse, then you're going to have people funneling into our profession because we have multiple barriers that they're never going to go away. The cost of money is a barrier to weed out people. The testing is a barrier to weed out people. So those things are probably never going to go away. But we need to figure out how do we get around them. And that's going to be visibility, and then having something that's put in place for low socioeconomic status. When you do apply, you can say, okay, I'm low socioeconomic status. Okay, well, we're going to waive your cost for the application, or we're going to waive your cost for the test. So those are the ways that we can kind of get through it, is basically going back to the junior highs, going to the high schools, going to the elementary schools, and showing who we are, doing health classes as a PA. And then from there, then we can slowly work around those barriers of testing and money.
Wow, thank you so much. The next question is, how have you ever experienced, witnessed racial bias in PA school or working in the field? So yeah, if you can talk a little more about your personal experiences on those.
Okay, I'm gonna throw it back to Tony. So we kind of, I feel like the brunt of it is falling on me if I go first every single time. So let's mix it up. Tony.
Oh,
And
we
by
like
the
to
way,
hear from Karen.
I'm a huge fan. I'm like fangirling. I was like, what?
Stop it.
I was. Go for it. And then no,
But
and then I'll go last.
so experience things. I experience things almost every day. It's how you deal with it that makes you a better person. So, being in healthcare, and walking into a patient's room and you're the first person that they see and you're not what they are used to seeing, you automatically get the big eyes and then you have to kind of talk them off the ledge. And that's what I do every single time I walk into a room. And then they realize, okay, he is friend, not foe. So, but I get it all the time, but I just play it off because people don't really know their body language. And I see the body language all the time. So I kind of know how people kind of present and so, some of the things that I've done in the ER, I've been called different names because I didn't give them that favorite medication, and so I just brush it off. You get thick skin when you see it a lot, and so I've had a lot of things happen to me over the course of the years. Not so much in PA school, but practicing in a predominantly Caucasian Hispanic area within California. I get it all the time, but I don't pay it no mind anymore because that's just people ignorance and I don't feed into it. So I just keep it pushing.
I love it. Nan?
Actually going to ask you to repeat the question. I wasn't sure if this was in regards to patients' racial bias or if this is something for us as providers. So can you clarify in that question?
Yes, let me repeat the question. Have you ever experienced or witnessed racial bias in PA school or working in the field? So as providers.
Okay, thank you. So yes, I mean, hello, we are living in this, COVID-19 pandemic. Right when it all first started, when everyone threw out that, oh, this is the China virus. I remember it was early on March of last year. I met a new patient, sat in the room with them and they asked me, how's your family doing? And so at first I'm just like, oh, well, they're just being extra friendly, not understanding that he was implying that because I was Asian or, I looked like I was Chinese, that meant, how's your family in terms of COVID-19? And so since then, and especially where I work at now, dealing with veterans, at times I do face, these racial biases and all that you can do is just, like they say, just kind of kill them with kindness. If you're upset by something, try to speak to them and say, essentially addressing the issue as it comes, and trying to figure out why or what the mistrust is. But, again, sometimes it just comes that people will just never trust you. And at that point, I hope it doesn't get that way, but it may just be best that another provider sees them. And so that, I haven't had a point where a patient flat out refused to see me, but I know that it can happen.
Very well said, Nan. Thank you for that. For me, it's been a little bit of a different kind of situation. In PA school, I really didn't experience any kind of like racial bias, at least that I picked up. In practice, I definitely have, but never so much from the, oh, she's a Hispanic aspect. Well, except for people always saying that I'm late and like stuff like that, which sometimes is true, whatever, but that's a sidebar. That's a stereotype. My experience has more been with the stuff that the organization that I work for puts up with from patients. And that's where I have a problem. That's where I have a massive problem. And in working in surgery, I feel like Tony and Nan, you guys are dealing with awake patients for the most part, except obviously Tony, when you're in surgery. And you're having to deal with the brunt of their, emotional persona, in addition to whatever disease and whatever stressors they're dealing with. So their charge is very emotionally charged, and anything that's ugly will and can come out. Whereas me, since I'm mostly in the operating room, my patients are mostly asleep, but also my interaction with them tends to happen via other people. And I have been witness in a few times in my career, probably 5 times. And the last one that this happened was probably maybe a year ago, where one of my African-American friends that's a CRNA, she's excellent, well-respected, experienced, you name it. She just runs circles around everybody, even her own attendings. She's incredible. And there was an older lady that needed her heart done. And the lady was like, I don't want, he basically refused for her to be her anesthesia person. Meanwhile, she's the best one there. You know what I mean? So it's somebody that was in their 80s. They have a different experience, blah, blah, blah. And she was so graceful. And every single anesthesiologist or person of color that I've seen this happen to, and it's almost the same scenario. It's like an older person that probably, was alive when that was like out and normal, and they refuse to be taken care of by any person of color whatsoever. And they've all been very graceful, and they're like, yeah, what, that's fine with me. And they walk away, no problem. Oh, I'm used to it, this and that and the other. They have multiple experiences of that. And my outrage is not necessarily for the patient, because like Tony said, it's, what are you going to do with ignorance? You can't entertain it. You can't deal with ignorance. But my whole thing is, how about the hospital? How about, the leaders that you knew this person, like this wasn't the operating room in the hospital wasn't a first stop for this lady. She went to her doctor, she went to like all these people saying the same crap, and you open the door for her. Like I just, sick people are sick people, but at the same time, I just think that the organizations that we work for need to do a much better job of protecting us and protecting their employees. And it is enraging to see something like this happen. And because patients can get away with anything, you've seen it, like staff abuse, doctors getting shot, like nurses getting spit at, like it happens on all levels. And I just don't think that just because you're sick and you're a patient, we should always tolerate crazy behavior like that. So that's just my 2 cents of that.
All right, thank you everyone for your responses. For this next question, let's start with Nan, and then Tony, and then Karen. So the question is, how do you think being a person of color PA differs from the experience of your white colleagues?
I would also like to add a woman of color and how that differs to my male colleagues. Yes, definitely, this isn't just for PAs, this is medicine. I came from an ENT background. I saw recently in a group that women ENT surgeons get paid much less compared to their male counterparts. And so the way I feel, and this could just be just all internal, just based on my experiences growing up, but that there's this added pressure of how I always have to push myself to prove myself that I'm just as capable of caring for my patients as my counterparts. And so, it's not always easy, but again, I think that's where your hard work and determination and taking care of your patients the best way possible. With time, your work speaks for itself. And so, yes, it's not always easy. I may not just have an equal platform to stand on, but I will get there.
Perfect response, my girl. And I feel the same exact way. First starting off as a PA, and my attending didn't have any African Americans because there's not a lot of African American PAs to begin with. So we're very far and few between. And so trying to, as a student, when I was doing my rotations, I was in the military for 9 years. So I knew that I had to perform better, exceedingly better than everybody that didn't look like me, regardless of their race, because of who I am. And, and you're looked at a lot different when you are a person of color. Is like, oh, can they really actually do what they say they can do? And so for me, I had it in myself that I had to do above and beyond the call of duty to be a person that's going to be recognized as somebody that knows what they're doing. And it's unfortunate because, you know, people look at you and they're like, oh, he doesn't really know what he's doing. Is he going to kill me? And so you have to go above and beyond. And so you have a different colleague that looks nothing like you, that's a different race, and they believe them 100%, just like they believe the doctor 100%. And you were just in there 5 minutes ago telling them the exact same thing. And it's like, and then when I get out of the room, I tell my attending, I was like, I told that motherfucker the same thing, and they didn't listen to me. So, and it happens all the time. And it's because they don't trust me. They don't believe me because of maybe what I look like, or maybe it's my title. I don't know. You know, it could be all the above. So it's a constant threat to people that I take care of, that I have to be much better for myself in order for them to realize that I am worthy of their healthcare provider and to take care of them wholeheartedly, like they're my family.
And next we have Karen.
Karen,
Unmute.
you're muted.
I'm like, blah, 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 blah. Okay, yeah, sorry. Thank you. I just said that both of you guys really encapsulated my feelings on the issue. And I'm the oldest of 5 kids, okay? So I got to this country when I was 14. My mom didn't speak English, and I have 5 younger siblings that I took care of. So one thing that I realized early on was that being mediocre was not an option. Sorry, it just wasn't an option for me. It wasn't an option for my siblings. And the sooner I help them realize that if you want to be taken seriously, you have to be better than everybody else, no matter what race they are. You have to be better than everybody else, no matter what sex they are, because you just have to be good enough so that people forget what you look like, where you come from, and who you are. And that's something that I've maintained, and I teach that to my students. Like, you have to be so good and that you make people forget who you are and where you come from and all of their biases and all that crap. Like, because people, one thing that people will always respect is somebody that's good at their job. If they realize that you're good at your job, like a lot of times, at least in the workspace, your colleagues will be like, all right, well, let me get out of the way. This person means business, in my experience. Something that I want to kind of bring attention to as far as that goes, being a PA, a person of color, navigating in this healthcare world, and especially as a woman, because that adds a whole other layer of intersectionality, is that people don't realize the perception and the experience that Tony is having as a Black American male, and that we are having as women. And I can put it to you like this, like, and maybe I'm dating myself because I'm like pushing on 40 here. Remember the movie Honey, I Shrunk the Kids? Where basically, like, it was with Rick Moranis, and he had a laser and he had 2 kids, and the kids shrunk down to like ant size, and then they went into their backyard and everything was huge, and there was this whole other world that nobody even knew what was happening right on their lawn, like this whole, like, ants fighting like snakes and like all this stuff. And the same thing happens when somebody like Tony, somebody like myself, somebody like Nan is having a completely different experience in the same setting than everybody else. And a good example of that is that recently I started working in a new hospital where I'm so fortunate that I'm working with 2 other PAs of color, and they're both male. One's African American, one is Muslim, and they're incredible. When I tell you that they're better than the surgeons, but I'll never say that to them, they're incredible, technically gifted in surgery. That it was just like something that blows me away. So I'm very proud to be working with them. But even then, as a Black man and as a Muslim man, when I came in there and I realized, like Tony said, the body language, how people treat women versus men, how people look at me, how the women get jealous, how they hate on me, how they blah, 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 all this other world that happens underneath. And it's just something that's why it's very important to be able to read a room. You have to have that perception. You have to have that perception of being able to not only read a room, but be open to the fact that other people are experiencing the exact same thing completely differently, and have respect for that. So that's kind of like my recent little thing that I experienced. And I told my coworker, and he was like, I don't understand. I don't really see nobody's giving me attitude. Nobody. I was like, I told my I was like, Kirk, do I have to explain to you as a Black man that it's different for me than it is for you? And he was like, oh, and that's when the lights went on. It's like, I bet, and he was like, oh, I didn't know that happened to women. So you see, like, just because we're people of color doesn't mean, or, that we understand each other per se and everything. Well, that's another thing. All right, mute on.
Thank you so much for sharing. So the next question is, as a person of color, how have you dealt with the microaggressions in a respectful manner without compromising your own integrity / respect for yourself? We can start with Tony, Nan, and then Karen.
Yeah, I kind of touched on this a little bit earlier as far as, things that I see when I walk into a room, and I just kind of brush it off like whatever, and I don't skip a beat. I've taken care of one guy that was in the ER, and he had a bunch of, colorful tattoos on him as a Caucasian guy. And I saw the tattoos as I'm stitching him up, and I didn't even worry anything about him because that's his preference, but I'm still take care of him regardless. I've been blessed by God to be somebody to take care of people, and I don't care how they perceive me. So I don't, with the microaggressions, I've experienced it, but it doesn't bother me. Only thing that bothers me if you hurt my wife or my kids, but other than that, everything else just rolls off my back and I keep pushing.
Great words there, Tony. So yes, I think I touched on this earlier. In these incidents, I think in the past, we've always been taught just to kind of let it roll off your back, ignore it. But all of that, after years, it does in a way kind of traumatize you. And so, I can't think of any specific example because I feel like it happens so commonly. But I think it's time that we actually speak out against those that are, if we're not happy with what's being said, maybe correcting it then and there. So for example, just saying like, hey, I'm sure you didn't mean it like this. However, what you said, was offensive, or I'm hurt by this. Instead, can you please use this term instead? And actually, it just an example just popped into mind. So very recently, a patient called myself and one of the residents Oriental. And so as we know, that term is very much outdated. And so unfortunately, in that moment, I would have corrected the patient. However, my attending was in the room with me. And so, but if I had the room and the space by myself, I personally would have corrected the patient and said, hey, thank you for recognizing that I look different, but I just wanted to correct you that I am, hurt by this term. And just hopefully at that point on their own time, that individual can reflect on that and make the appropriate changes next time.
That was really, really great input. I love that you actually take the time to correct people. And I wish wholeheartedly that I was like that, but I am not. I am kind of more of the person that nothing bothers me. Nothing a patient tells me, like, it will be really hard, like difficult to upset me if it's coming from a patient. I don't know if it's because I feel like, well, they can't judge me because they don't know me. They don't know my heart. They don't know what kind of person I am. And they're on their own little fantastic voyage that has nothing to do with me. And I always tend to think that nothing anyone does is personal anyways. It always tends to be more about them than anything else. What hurts me more is if I hear it from people that know me well, like, that coworkers that I've had for a long time, things like that. And then it becomes a difficult thing to navigate, especially in the operating room, because the operating room tends to be kind of a good old boy space. There's a lot of crazy raunchy sexual jokes and racist jokes and all sorts of things. And for me as a woman to stand up and be like, stop this, you guys, stop this. I would get buried where I stand. I wouldn't be able to even work with these people because I would be probably excommunicated because they wouldn't want to be censored. And this is, I'm honestly telling you that it's a difficult thing to navigate. All I can do is either tell them to shut the fuck up, which I do often, and I'd be like, shut the fuck up. Like, what are you even saying? And kind of like take it on that level of you to you between me and people in the operating room, like, like this, just to stop. But and also I work with a lot older people. I'm the youngest one there by years and years. So I personally don't have the bandwidth to be able to correct all these people that are set in their ways and stuff like that. If they were younger and maybe more receptive, I would, but that is not something that I have the bandwidth for right now. So how I deal with it, if it's not coming at me personally, then I just kind of do that. I kind of just tell them to shut up and keep it moving and let it roll off.
I just want to add to what you said, Karen. So yes, definitely, it's not always easy. Definitely pick your battles, right? I mean, there's no right or wrong answer. It's just how you feel and how you respond. And maybe too, because Karen is so much wiser and older, and so I'm learning, right? I'm still a baby PA, and so.
No, you're doing it your way, where that's just it. Like, we're different people. I don't know that it necessarily has anything to do with age or anything, but it's just like, again, reading the room. And I just know that doing something like that in the space that I'm in right now with the people that I'm dealing with, that I feel like hospitals have cracked down on bad surgeon behavior pretty much everywhere, and this is probably the one space that they haven't penetrated yet. So the surgeons are wild in this place, and I'm having a hard. And I feel like I have a PhD in heart difficult personalities, working with all these egotistical cardiac surgeons, which I love. They're an animal that I know, but they're also a pain in my ass. And this place is giving me a run for my money right now. I'm just like, woosah, like every day. I'm just like, I'm gonna kill one of these motherfuckers. So it depends.
All right, thank you, everyone. So our next question is, how can pre-PAs as future clinicians commit to practicing socially conscious care? Let's start with Karen, and then Nan, and then Tony.
What's really great about this generation of PAs, that because of everything that's happened, the civil rights movement, socially, all the issues that have come up, I feel like the people that speak out the most and do the most educating are the younger generation. And they are relentless. And for that, I'm very hopeful that they'll have it a little bit easier, or not easier, I should say, but they are less burnt out and less tired, and they probably have a lot more energy to correct people and educate, and eventually they're going to be leaders in the space, and then there's going to be real change. So I'm excited that they're going to be taking that on. But as far as how can they ensure that they practice socially conscious medicine, it's just to educate themselves. Honestly, self-education is going to be the way to go. And I feel like everyone should have a personal curriculum of self-education when it comes to this issue. And maybe that's something that, I don't know, Tony and Nan, if you guys would be interested in putting together something like that, like maybe a reading list or something, because I feel like there's just not enough. They're not going to force people to have this training. It's not in the schools. You get like one lecture if you're lucky. Maybe you'll get more. Maybe you'll get like 2 days of worth of lectures now with everything that's happened. But the truth is that self-education is going to be pivotal. And I know that it's a lot to add with the education and PA school and the testing and It's going to be a lot, but it's just it's work that everyone has to do. Everyone in healthcare has to do it. Unfortunately, it's not required, but I think it should be. So I think that people should be, the most important thing is to be self-motivated about their own education, and then acknowledging that nobody knows shit. Even people that seem like they know what they're talking about, like me, I don't know anything about anybody else's experience or whatever. I'm always willing to learn and to, never stop learning, and take it upon myself to educate myself on it and listen to the people that know what they're talking about most of the time.
100% what Karen said. I mean, she definitely hit the nail on that one. You cannot expect the programs to teach you this. You cannot, as much as we like to hold our employers accountable, it's not. It's a cultural thing, and that takes a lot of change. But what can you do? You can change yourself. You can better yourself. Read, ask questions. Just really reflect. When you have a patient, question yourself: Am I putting on any type of biases on this patient? So just taking a moment, really listen to your patients, to what they're saying, and kind of think outside of the box. For those of you that are still in undergrad, if it's possible, I highly encourage everyone to take an intro to public health class. I think these programs or these classes give you somewhat of a foundation of things outside of medicine that affects a patient's care. But definitely it's just going to be a lot of personal growth, always reading and trying to challenge yourself. But yeah, I think pretty much just what Karen said there.
All right, so I agree with Karen and Non, along with Non, you know, being in public health and had public health before going into PA school allowed me to see other cultures' issues on health disparities. And these are the things that are not addressed in PA schools. And so I think, along the lines of what Nan is saying is that you need to kind of look in public health disparity classes, and then you kind of go through and see. And I think every PA program should involve some type of public health aspect of health disparities and what to be expected, and then have people that come from each background kind of explain to them what do they feel when they go to a doctor and how they feel, because within the African American culture, we've been kind of not loving medicine ever since the slavery days, where people used to get kidnapped and people would do different things to slaves just to figure out if this thing it will help the majority race. And then Tuskegee Airmen, when they were saying that they're giving treatment for something else, but actually giving syphilis. So these are the things that within African American culture are the reason why people of African American descent don't really trust doctors or healthcare providers in general. So you have to kind of go through and look at every different, wherever you're going to go, wherever area you're going to be practicing medicine, you need to know what are their complaints, what are the things that they normally do at home as their rituals, and what do they want to bring to medicine. Because you can't just come in there and just say, this is the gold standard. You take this Tylenol. I don't care about you putting cups on yourself. That doesn't work. Acupuncture is not working for you. It doesn't work. It's never been proven. You can't come in there and say things like that, because you're going to get a brick wall in front of you. So you have to be open to what they're doing and say, along the lines that you're using, how about we try some of this? And this will open up the communication that you're actually listening to your patient, what they do at home, and you're trying to instill your Western medicine on them. So it's all about once you are going into PA program, is kind of facilitating your ignorance of, trying to learn other people's struggle on how they have been navigating through medicine, and being that voice. Back in the 60s, it was very apparent that, it was a lot of disparities. And then as the years have gone on, people have just kind of waxed and waned. And then there's a new generation of younger individuals, and they have all the rap songs that has everything in it, and people just stop caring about it. And then when pandemic happened, then you kind of realize that America is still racist. It hasn't changed. It never changed. And for a lot of communities, we already knew that. It's just that people that always said racism doesn't exist, now they know it, because we have invented these fancy camera phones, and now they can see what actually goes on in the hood that people of color have been experiencing for years and decades. And so this is the reason why the things are so charged now because of our camera phones have captured pretty much everybody's lives. So go social media.
I love that. And Tony, that was really, really wonderful, honestly. Like it made me really think about something else that I kind of wanted to add to that, which is another work of anybody coming into healthcare, PAs, and how to practice more socially conscious clinical medicine is to recognize your own biases. Okay. And this is a very difficult pill to swallow because immediately everybody's like, well, I'm not biased. But even what Tony says in the arena of abuse of trust in the African American community, where they don't feel like they trust, traditional healthcare because they've been so damaging, that in itself is a bias. So how can we examine that and kind of like help? Because at the end of the day, we're trying to provide better care. And I'll be honest with you, I have a bias, definitely, and it's not necessarily my bias is IV drug abusers. Okay. And the reason I have the bias, and this isn't easy to admit, but it's something that I feel I have needed to examine, because how they became drug addicted is something that has nothing to do with me. It's extreme, a lot of things that, whatever, but I'm the person that has to take care of, watch these young people die because they've infected their valves and they come back over and over again. I've had to do organ procurements on a 19-year-old that killed herself with repetitive heart surgery and couldn't stop the IV drugs and this and that and the other. So yes, it may be somewhat founded where I'm just like, why do these patients keep doing that? And I'll never understand it because I've never used like IV drugs. Just, I know that it's not easy to get off of, but at the same time, it's something that challenges me as a person to examine that and try not to immediately be angry when somebody comes at me with drug seeking behavior. Try to understand the level of pain that they're feeling when they keep coming back for their heart surgery, instead of me being like, why are we wasting another valve on this person? Which a lot of us honestly have said and felt, because it seems so crazy. So the work is not just in, reading up and all this stuff. The work is also, I feel like, a lot of internal work that's not going to be easy. Then putting a mirror to yourself and be like, let me examine why. Let me examine, my patterns. Maybe things that were said to you by your parents and you just kind of never even thought of and never really examined. It's worth examining any kind of bias that you have, whether it doesn't necessarily have to be in the traditional sense, like in race. It could be like in any arena. So.
Thank you. So our last question before we open it up to any more of our attendees' questions is, what can applicants and reapplicants do to showcase / stand out to admissions and demonstrate their commitment to diversity in the PA profession? We can do Non, Tony, and Karen.
Yes. And I would say, honestly, just getting involved. I mean, I think being part of discussions such as what's going on right now, it's important. I think if possible, again, if you're still in your early years of college, join organizations, those that support minority groups. You can rally to fundraise for a good cause. But biggest thing is really just continue with the discussion. I previously interviewed with my PA program for the next application. And again, it's not something that all programs are really pushing. And so again, as Karen and what Tony had said previously, we just kind of have to work on this ourselves and make this like a lifelong mission versus holding our programs or employers held accountable.
All right. State the question one more time. Okay.
Of course. What can applicants and reapplicants do to showcase or stand out to admissions and demonstrate their commitment to diversity in their PA profession?
Yeah. So there's not much you can do. That's the bottom line. that's why I had to say the question again. So, the things that you can do personally, is what Nam was saying, is that you try to identify all those things in yourself, and try to figure out what can you do to bring somebody else up. You can, while you're in undergrad, is dealing with, like, so for me, for instance, I used to do something called Saturday Science Academy, where on Saturdays, I used to go to an inner city school where they brought in these elementary school kids, and then I just teach, and they're from the inner city, and I just taught them different type of topics that we had to do for that session. Either just being looking at things in the ocean, or then we're talking about solar system. So I was basically like a teacher, and I wasn't qualified as a teacher, but I did the best that I can. I even had lesson plans, and then at the end of each session, the whole group would go on a field trip somewhere. And so when we talked about ocean, we went to aquarium in Long Beach. So these are things that kind of stimulated this, what brought me in a PA profession, because I didn't know what a PA was, because I was trying to get into medical school. And then one guy that was part of the Saturday Science Academy at Charles Drew, he said, why don't you look at PA? And I was like, oh, snap. So doing something like that is part of trying to extend the branches of PA knowledge into these little kids. Like I said before, is something to kind of help stimulate the discussion of trying to diversify the PA applicants, because in order to diversify the PA applicants, you have to go to where these people are and meet them where they are. You're not going to get diverse applicants by just talking right here. We have to go to where they are, because a lot of kids in the inner city where I grew up, I was the youngest of two older brothers, and they were involved in gangs. They didn't know anything about anything else but gangs, selling whatever you can sell, and, hanging out with your friends. And in these inner cities, they know mostly sports and mostly music. So in order for us to break that cycle, we need to get them interested in medicine, in particular PA profession. So that's where a lot of the, if you want to start an organization within your campus, and undergrad, is trying to go to these inner cities and having different health forums at different schools, and talking to them about what medicine is and how to take care of yourself as a teenager, something random like that. But that's what I would suggest it is. If you're trying to apply to school and say, this is what I want to do, this is my potentially what I want to do once I get out of school, I want to start a program that goes into high schools or junior high school or elementary schools, and talk to kids about what is PA and how do they take care of themselves from a medical standpoint, how they eat good, how they brush their teeth. So all these different things. I can go on forever, and I'm already thinking of ideas. So I will stop because I know Karen wants to say something.
Yeah, I'm writing everything down. I'm a note taker. So I have 3 pages because these guys have said some really poignant things that I really love. Okay, so here's one thing that I tell all of my pre-PA students that are people of color, that obviously aren't in the statistical category of the normal PA. One thing that we have going for us over everybody else that no one can ever take away is that we are resourceful AF. What person is not more resourceful than a person of color that's had to live in this country differently? We are literally the CEO of MIH. We make it freaking happen. So how you can stand out to admissions is to be resourceful, do shit that no one else is doing. Tony just gave you 2 things. We identified a problem. High schools, elementary schools, they don't know who the hell we are. If you went in there and created a program with 3 of your pre-PA friends, and you made it an effort to go and speak at these places, and you hit up like 10 of your local places, 20, 30, and you start a movement, and you put that in your application, holy macaroni, like no one is doing that. So there's an idea for you to do. come back and let me know how it goes. We can help you with that in any way that I can. But being resourceful is the number one thing that'll help you stand out to admissions, because the whole thing about proving to admissions about how you're more diverse than everybody, they don't give a fuck. I'm so sorry to use this language, but they don't care about diversity because they're not invested. That's not even part of the things that they ask in the CASPA like letter of recommendation. It's not even something like, it's not even a checkbox, y'all. It's not even in there. Okay, so my recommendation to you, because I teach a course in personal statement writing for PA school, and this is what I hammer into my students: the resourcefulness that you have, think about the ways to advance your career and your like the PA profession at the same time, and do something that no one else is doing. And part of that is to find your why. You have to find what drives you, because guess what? If you get into those spaces, you know, you get out of your comfort zone, because it's easy to go online and Google search, you know, what pre-PA clubs increase diversity, and then send them a message and whatever. Don't be a behind the computer soldier. Boots on the ground, honey. Boots on the ground. Get on Google, call the freaking local high schools, look up what, you know, people are needing the most help healthcare wise in your local. Start at home, start in your neighborhood, local, so you have a heart, so you have a connection to who you're helping, and go do it. And I promise you that if you haven't found a reason that you're pursuing medicine past I want to help people, you will find a freaking real why and a real drive to get there. That's, you know, once you get to talk to these people, get to know these people in your backyard, in your neighborhood, that are suffering, that are, you know, treated differently, that don't have money, that don't have access, that are discriminated against. You sit there and you spend time with those people, and it'll fuel a fire under your butt unlike anything else. And the personal statement will write itself, because you will not have to fake the funk. The difficulty that people have with that kind of stuff, standing out to PA school, is people that are faking the funk. So don't be afraid to dive deep, get personal, boots on the ground, resourcefulness. We do not have the option of being mediocre. We have to be better than everybody else. We have to. And it's not, yes, it's unfair. Yes, it's unfair. Yes, it's unfair a million times. We don't start out in the even playing field. We don't. We're not all born with the same things, but we even it out as we go. And in the end, like it'll just be better for everybody if you keep that in your head. Mediocrity is not an option. You got to be better than everybody else. Tony, I'm like, oh my God, I'm talking to Tony. Everything you said, I'm like, yes! All right, so you guys have any questions, I guess? Unmute yourself so we can have a conversation. Nan and Tony and Sarah and Min.
That's right.
Yes, we can open the floor to questions. So if anyone wants to type their questions in the chat, I see a couple, so I'll go ahead and read them. Mylan says, was diversity something you looked for when applying to PA programs? Any of the panelists can go ahead and respond to that one.
No, was that,
Yeah,
I knew that
no.
I was gonna go to
Yeah.
Whiteson school. Like it just wasn't, honestly, in 2004 when I was, it wasn't even like, no. Mm-mm.
I was the only Southeastern Asian in my class. So again, we have a lot of work to do. So maybe our grandkids or children one day can look for diversity if they also want to follow me and become a PA, but it really isn't an option.
Yeah, it's not no option. So you look at a PA school on their passing rate. So you want to know what they're preparing you for as the PANCE exam. But other than that, it's not something that you look at in the forefront when you, as well as when you're looking at the area that your PA school is at. That's where your diversity comes from, is where you're going to school and you're doing your training, because you're going to get diversity from your training, not from your PA school, because your PA school is going to look like how a medical profession is, where the higher numbers are Caucasian and the lower numbers are the minority. So that's what the PA school applicants look like. So, and it's like 1% PAs that are African-American males.
And in saying that, let's think for a minute. Let's compare with the nursing profession, right? Because the nursing profession is something that, I mean, obviously it's an older profession, but if you look at a sample size, there's a lot more diversity in the nursing profession. And you can compare the two and be like, okay, well, the reason is because of the accessibility and the price. You can go to nursing school and work. You can go take this course at community college. So you know what a nurse is since you're in kindergarten because there's a school nurse, and so on and so forth. So it's I don't know, I forgot what the point that I was making, but you know what I mean. Is there more questions?
Yeah, let's ask the three that we have right now. So the next question is from Winston. What could or should the AAPA be doing to affect the changes you are suggesting? For example, Health Career Opportunity Program.
So I, myself and two of my PA colleagues that I went to school with have been in contact with AAPA to try to do some type of summer program and trying to do it at different PA institutions where high school kids from inner city go to these PA programs for 3 to 6 weeks, and they stay on campus and they go to class with the PAs and or do different things. And because I did something like that, it's called a summer medical dental education program that was through a medical school stuff. And this is when I was interested in medical school, and I went to Washington and Seattle, and I stayed in Seattle campus for 6 weeks, and we went to class, not with the medical students, but we went to like a class and we talked about different things. And then we were tasked every week, we were tasked with mentors, and we would go to different medical offices and just be their shadowing. So we're doing a proposal now with AAPA and trying to branch this to different PA schools for high school and undergrad students from inner city to do the same type of model, going to PA schools and sitting in on different classes and going through prep for the PANS, and then going and shadowing doctors or PAs or nurse practitioners within the community.
That's amazing. That is like the best thing I've ever heard. Thank you for that.
You got it.
Next, we'll answer Christy's question. Do you recommend taking a gap year from transitioning to undergrad to grad school?
I'll answer it again. So gap year, no gap year, it does not matter. You need to get whatever you need to get to school. Everybody is on a timeline, and you can't be on a timeline. Things will happen at its own time. So don't worry about, oh, I have to take a gap year, or I don't want to take a gap year because I want to get right into school and start working right after. For females it's a little bit different because ovaries are ticking, so they want to get in and get out so they can have kids, but it's only 2 years. So it's not like medical school where it's 4 years and then a minimum of 3 years. It's 2 years. So take your time. If you try to rush this thing, you will mess up trying to get into PA school. Take your time. There's no rush. Nobody is rushing you. Nobody is pushing you. If you try to force it, it's not going to work. If you take your time, do it gracefully, do things that are meaning to you, the admission committee will see it. If you're doing stuff and you're doing like 50 different things and you're trying to apply with 50 different things you put on your application, it's going to look like this guy doesn't know what he's doing because he's doing 50 different things. Do one good thing and do it well.
Forget about what everybody else is doing. That's a good piece of advice across the board, because everybody, the timeline thing is real. It's real. I get people telling me, hey, is it too late? People asking strangers on the internet, me on social media, hey, is it too late for me to go to? I'm like, how is it that people are asking me that question? You're on your own thing. Like, I don't know. Like, no, it's never too late to do anything you want to do. Just, examine yourself as to what's going to be your genuine timeline and your own thing. Like, spend more time going within and figuring out yourself and what's going to be right for you, rather than asking the outside world, because a lot of times your parents are not on the same path as you, your friends are not on the same path as you. So it's important that you develop that sense of self which later as a PA translates to clinical intuition, which is priceless. Okay. It's like witchcraft. Am I right? Non and Tony, that clinical intuition. Oh my
Your
God.
mother.
You can diagnose things and you're like, oh my God, I'm a witch. How did I know that? But it's that strong sense of self. You got to ground your shit. You gotta really like stand strong in your own two legs and spend most of the time in here rather than out there. Like, listen to very few people, put through a filter of your own resonance. Okay. If it doesn't genuinely resonate with you, it has a different feeling in your body when, you know, things resonate. No matter whose mouth it comes out of, me, it doesn't matter. Just make sure you put it through that filter and you will find your path a lot easier. Forget about what everybody else is doing. It's a highway. It's like I-95 here in Florida.
I want to piggyback off what Karen said. So one thing as I look back, if there is advice I can give to my younger self, is to enjoy the process. I mean, again, we're always racing against this, you know, really invisible or non-existent timeline. You know, life will happen when it's meant to happen. I was not a traditional student. I received my master's in public health before I even knew I wanted to apply to PA school. So I really can't say what's a gap year, what isn't. So with that being said, be genuine to yourself, work hard, but have fun, enjoy the process. You know, when you're in medicine, you are a slave, it's tough. So try to make the most of your years. And then I want to add, don't just join clubs or do things that you think looks good on paper. Like, oh, what type of classes should I take? What type of organizations, what should I be doing that looks good on PA school? Like, who cares? Enjoy. This is your life. Do things that you want to do. You know, in college, I lobbied with Planned Parenthood. Is that impressive for school? I don't know, but I enjoyed it. I had fun. I met amazing people. So do what you want to do. This is your life. This is your journey. You will get there. Put the time, but then also enjoy it. That's it.
Yes. The secret sauce is you. The secret sauce is you. That's something that nobody can take away from you.
That sauce.
That sauce is you.
Sauce is boss then.
Yeah.
Thank you. So let's go with Key's question. And this will be the last question before we end it. Key says that I noticed that there's a lack of diverse representation in how medicine is taught. Have you ever felt that what you learned in the classroom was different during clinicals? How can I help increase this representation in my PA education?
Well, the thing is that what they teach you in school is all usually evidence-based as far as clinically. Like I said, they don't touch, at least when I went to school, they don't touch a lot on how to deal with different patient population and how to maximize caring for these people. So, you know, except for the difference between like a coloring anatomy book and like real anatomy, where it's completely different. You're like, holy moly, like nothing's color coded on this guy. It is pretty clinically similar. The learning curve, I feel like, comes in the stuff that they don't teach, right? So that's kind of tends to be the area that I'm most interested in and what I speak on the most in on my social media that I use as a platform to, you know, talk about like PA stuff and whatever. I'm so interested in the unspoken things that they didn't teach you in school, whether it be how to deal with difficult personalities at school, whether how, you know, your finances, like that's what I'm particularly most interested in. So how to bridge that gap is a great question. I feel like there definitely should be a lot more education, but at the same time, like we said before, I wouldn't wait for them to make it a mandatory. I feel like the self-education needs to happen. So the way that you make sure that you don't come out and you're completely, you know, caught with your pants down is to educate yourself as much as you can. And at the end of the day, there's only so much education you can control. Like you can read 5,000 books about swimming, and until you jump in the pool, it's not going to help you. So experience is where it's at with that.
And I would add that, you know, with the different PA programs, they have to look inside themselves. And what I just recommend earlier and going a little bit further into it is trying to locate different organizations that represent different ethnicities in healthcare, and have the representative come in and then talk about what his people go through, or what their conceptions when they go through medicine, and how they, when they enter the medical arena, how they feel, how did the providers make them feel? And they have a slew of information of how each person that come to them, or how their community at large feel when they go to see someone in medicine. So we have a huge population of Hispanic here in Southern California. And I can go to the Hispanic caucus and have them come to a PA's class and talk to them about medicine within the community. And then I can go to the NAACP and have them come to and talk to the PA group about, because at the end of your school, or at the end of your training, usually there's a lot of little classes that are not really needed. That's where you can fill in the diversity talk of how you can be a better professional in different ethnic groups, in different communities. And this is where you can bring in all these different people from Vietnamese, Latin Americans, African Americans, Native Americans, all these people that can come in here and talk to us about what are the people in their constituency that they experience. And I think that's perfect. You don't have to go far. You don't have to open up a book. You're going to get the firsthand source of what the people are saying.
I love it. Pass the mic. Yes, that's a great idea.
Becky, it's on you.
Yes, Becky, we want to hear your question. I was trying to mouth you. I was like, Becky, see you.
No, you're good. Hi, Nan. Hi, Karen. Hi, Tony.
Hi.
Huge fan of y'all's. So as a Latina who's applying to the cycle, to PA school this cycle, I did have a question, because the lack of ethnic diversity amongst PA students and eventually PACs is definitely problematic, in my opinion, especially when we're trying to match ethnicities of providers with ethnicities of patients and just trying to make patients more comfortable. How do y'all personally deal with doing your part for your POC community and leading other providers down that road with you?
That's a great question.
So I think as part of the theme, and what Tony and Karen have kind of said throughout some of our responses, is mentoring. We have to give back. So since I graduated, I've really mentored, taken on, students. I know shadowing is tough right now, but since I can't be there, or we may not live in the same state, but just offering mentorship, I think that speaks volume. I mean, Tony's brilliant examples of going down as far as like elementary kids, just having better representation. As far as the Vietnamese population here in Florida, it's still not that large, but I'm still here. And so I think, to diversify the profession, it kind of starts by just taking a part of you and passing it down. So I would say mentorship.
I'll add to that. So doing my part for the people of color community, I want to split it up into two different things. One, what I do for the patients, and then two, what I do for the future of the profession, or my profession as a whole, and how I elevate it. So the way that I take care of patients that are people of color is that I tend to be a liaison in between what culturally I know that they mean, what they're looking for, how they want to feel comfortable. And I have those conversations with them in Spanish, if it's somebody's grandmother, and I try to understand the family dynamics and get all in there, like if I was part of the family, because it's easy for me to do for other Hispanic people. That's very simple and very easy for me to do. And the people that are not of my same culture, I try to do the same thing as much as I can. So that's the way that I do that for my patients in a surgical setting. Also, there's a higher incidence of non-compliance among people of color. So for them, I don't let them go. Like I literally, like, I did the surgery and I'm like calling the family. And like, for instance, I operated on a patient on the 6th, and today I'm still like, hey, what are you doing? I'm like his own little personal stalker. And no one's paying me to do that. Like, it's just something that's always been very natural to me. So for my patients, I use the knowledge that I have in understanding what it's like to be a person of color in the healthcare system. And I try to do everything in my power to bridge the gap in any way that I can. Also, the future PA community is something that I've done a lot of work with ever since I graduated, because I just felt like the journey to PA was fraught with so many pitfalls and so many obstacles. And just when I thought I was at the top of the mountain, I've been knocked off by something else, whether it be the student loans came and they said, no, they're not going to give you the whole money for the tuition or whatever. It's been really hard. So I'm especially passionate about helping future PA students. I precept PA students in the operating room. I work with a lot of PA students, but I will say this, there's a huge lack of mentorship for people of color. And here's the socioeconomic aspect of it. People like me that are first generation and like non, there's pressure on us that you don't see, which is elevate my family out of a generation of poverty and all these, wise and really strong driven drive. So my job in surgery is hard enough, and then I do what I can. I shadow, I do this and that. But here's the thing. There's such a disparity in the amount of people that are doing it and the amount of students that need it. So I get flooded to the point where it just became too much. Every waking second I was not spending time with my husband, not spending time with my family. And I just completely, and I think that all of us probably have that within us, the ability to give too much, right, in healthcare. And it just has become a huge, huge issue. So I had to really scale back, and I can't help everybody. So part of my whole process and journey is realizing that as much as I want to help everybody, I can only do it to the best of my ability. And that's what I recommend that everybody does. At the end of the day, it's a numbers game, and the more we do it, the more people we're going to help. But for me personally, it required me creating a product that students have to pay for in order to be able to make it worth my time away from my family. So I do have a paid course on personal statement writing. I do a lot of stuff for free, but I'm sorry, like a lot of people, they think that mentorship should be free for people of color, and how can I do this and how can I do that? I mean, honestly, nobody's saying that. I'm just honestly imagining that people have maybe these thoughts. And my thing to you is, it's either I do it this way or I don't do it at all, because it was really, really costing me sanity and all this stuff. So there's different things that you do. You have scholarships and this, and that, and the other, but always, for me, the most important thing is sustainability. So sustainability from a standpoint of a mentor, from standpoint of a student, whatever it is, you got to make it sustainable. And that's kind of I just want you guys to have that awareness that there is a huge lack of mentorship, because we're just trying to survive ourselves. We literally just landed on solid ground. We've been swimming and drowning for a long time. And so that's that.
All right, thank you to our panelists for answering our questions. We apologize for not being able to answer everyone's questions in the chat. We don't have enough time, but are our panelists able to leave their contact information maybe in the chat?
Yeah, absolutely.
For anyone else? I know Tracy and John had questions, so they can go ahead and maybe send you an Instagram message or something.
I'm trying to get the chat up. Let's see. More chat. Here we go. I'm going to put all my information here for you guys. And email is probably the best way to get me. I don't do DMs. It was just way too overwhelming. So I turned them off, basically, except for people that I follow.
All right, perfect. Thank you, everyone. This was a great panel. I think it was very informative and helpful for a lot of people. But yeah, thank you for having this conversation with us today and coming out. And our recording will be on YouTube. Our channel is Pre-PA Transfer Association if you wanted to share it with anyone or rewatch it. But thank you, everyone, for coming in today.
Awesome. Thank you so much for having us. This was great. Thank you so much.
Thank you.